everyone, good afternoon. Thank you for joining us today. My name is Sunny Shi. I am an analyst with the NHSN Acute Care Analytics team. And today I'm going to be going over troubleshooting the LabID event SIR. Next slide. So my goals for this portion of the presentation is that participants will be able to identify some best practices before running analytic reports. And this will hopefully help prevent issues in reports and any missing data within reports. We'll also go over some SIR exclusions to be aware of, where you can locate the risk adjustment factors that are used to calculate LabID SIRs. And then we'll also go over how to understand which events are contributing to your LabID SIR numerator. Next slide. So prior to running the SIR report, I have three kind of big categories that I personally like to check prior to running an SIR report. You can also check these after you run the report, but I like to check them prior to running a report to save me some time. And those three are monthly reporting plans I check alerts, and then I check data set generation. And we'll go through each of these in detail. And just for reference, this part of the presentation is also applicable to other HAI SIR reports, not just LabID. Next slide. So for monthly reporting plans, what's important to remember is that only in-plan data, which is data that has been designated in your monthly reporting plans, are the ones that receive NHS alerts on the homepage. And additionally, only in-plan data is included in the CMS analysis reports. So you can see this is kind of what the LabID portion of the monthly reporting plan looks like. I like to check in the monthly reporting plans, make sure that locations and the organism that I'm following is completed for every month that I am looking to report data for. And then there is more, there's more details, but if you need help with setting up monthly reporting plans, there is a guidance link on this slide. Next slide. So some common issues that do pertain to LabID for monthly reporting plans is that occasionally we'll see missing locations on the monthly reporting plans that are not included. And so those data are not considered complete. So required locations, if you're following LabID reporting for FactWrite-In, you also have to follow ED and observation locations. And that's because data from these locations are used for risk adjustment for a lot of the LabID SIR models. Additionally, if your facility has any CMS certified IRF units, those locations also have to be designated separately on your monthly reporting plan so that you can get alerts and complete reporting to generate complete reports for those specific locations. Additionally, another common issue we see for LabID for monthly reporting plans is that not all 3 months in a quarter are complete. So maybe an organism or a location is missing from one of the 3 months in a quarter. And this causes an issue down the line because a lot of the LabID SIRs are calculated at the quarterly level or higher. And so if all 3 months aren't in the monthly reporting plan and data isn't complete for the entire quarter, the SIR report will not generate an SIR in many cases. And then an easy way to check and make sure that your monthly reporting plans are complete is to either run the monthly reporting plan line listing report in the NHSN reports folder. It's under the supplemental reports, or if you're checking for a smaller quarter, I sometimes just check manually within the application and just verify that all your locations and organisms that you want to follow are have been added to the monthly reporting plan. Next slide. So the next topic area that I check prior to running a report is the alerts dashboard. This is the first dashboard that pops up when you first log into NHSN. It's important to remember that alerts are only created for in-plan data only. So if you did not add a location or an organism to your monthly reporting plan, you will not get alerts and reminders for reporting. Additionally, in-plan data will be only included in the SIRs if complete reporting is done. And this can be done by resolving most applicable alerts. And so when it comes time to run an SIR report for a specific quarter, I like to look through the alerts dashboard, make sure that there's no outstanding alerts for that month or quarter and HAI that you're looking to run an SIR report for. And just as a reminder, all of the alerts in the alert dashboard are interactive icons, so you can click on whichever alert box that you want to check, and from there, it will take you to how you can resolve the alert to complete reporting. Next slide. Some common data quality alerts that are specific to LabID are the incomplete and missing events alert. This alert is just if you've designated your following LabID reporting for a specific location and month. If you have not reported any events for that month and or you have not checked the report no events box, you'll get this alert. The next alert that's pretty common is incomplete or missing summary data. Summary data is required for LabID reporting in order to generate an SIR, so that has to be complete for the quarter, for the months in the quarter that you're trying to get an SIR for. So you'll get an alert if that is missing. And then additionally, another one that's specific for CDI LabID is to confirm the CDI test type. You only get this alert if you're a hospital with CMS certified IRF units, and you have to report a CDI test type for FactBite-In and your IRF unit separately. You only get this alert if those CDI test types don't match. So it's typically kind of a more rare alert to see, but does come up occasionally for LabID reporting. Next slide. And then finally, after checking monthly reporting plans and alerts, I will check the dataset generation page. I mostly just check it to verify when the last time I generated datasets was, and whether or not new data has been entered or edited since then. And if it has, then I'll regenerate datasets to make sure that the most up-to-date data is going to go into my reports. Additionally, I check the beginning and end date of the time period that I'm generating data sets for. And that's because like even if you've entered data for 2024, but your data sets were only generated for data ending in 2023, it will appear to be missing in the reports when it's not really missing. It just wasn't included in the data set generation. So I'll check this page for those couple elements. And then another thing to note for LabID is that regardless of the beginning and ending time periods that you generate data sets for, all LabID events will be included in dataset generation because all of the events are necessary for event categorization. Next slide. Okay. So I'm going to go into a couple analysis reports and referencing a couple of them for the remaining portion of my presentation. And so just to get everyone situated, these are the SIR reports. There are two types of SIR reports. I commonly refer to them as the non-CMS SIR reports and the CMS SIR reports. On the left side of this slide are the non-CMS reports. These reports are available under the HAI risk-adjusted measure reports folder. And the ones I'll be looking at are under the 2015 baseline section. These reports include all in-plan and off-plan data, so any data that your facility saves in NHSN for these organisms will be included in these reports. Alternatively, there are SIR reports under the CMS reports folder, and these reports are sorted by facility type, and they only include in-plan data. And in the report. Next slide. Additionally, I'll be referencing a couple of line listing reports. So just to situate everyone, these line listing reports are located under the HAI detailed reports folder under MDRO CDI module LabID events. Next slide. And then for my examples today, I'm just going to be using CDI, just so that we can talk through some specifics of the CDI SIR report. So this is just an example of the first table that you would see once you run an SIR report. This should look pretty familiar for most users. And these columns are ones that I will reference in a couple of the troubleshooting examples. Next slide. So my checklist for after running the SIR report that's specific to LabID is if anything is missing in your SIR report or looks a bit unexpected, these are kind of the things I consider when trying to troubleshoot my report. The first is consider certain SIR exclusions. Some are applicable to all HAIs, some are applicable only to LabID. I also like to review the risk adjustment factors that were used in the calculation of number predicted, which is the SIR denominator. I like to check the line listing events report and verify indicator variables for the events that are counted in the SIR numerator. And then finally, if I have any other things I need to need more details on or need to troubleshoot, LabID does have an SIR-specific troubleshooting guide that goes into a lot of detail about a lot of frequently asked questions about how the LabID SIRs are calculated. Next slide. So certain SIR exclusions you should consider when you're looking at your SIR report. If your SIR is missing, the first thing I like to check is number predicted. So if your SIR column is missing, I go scan to the left to number predicted events. And if number predicted events is less than 1, that is a reason why the SIR is missing and not calculated. So the NHSN doesn't calculate SIRs for any HAIs when the number predicted is less than 1. So that would result in the SIR, p-value, and confidence intervals to be blank or missing in the report. Additionally, for LabID, most SIRs are calculated at the quarter level. So if you're trying to run a SIR report for less than a quarter, that might be a reason why the SIR column is either missing or the quarter is missing from the table 1 of the SIR report. Additionally, for CDI in the 2015 baseline SIR report, there will occasionally be additional exclusion tables at the bottom of the report. One of them that can show up is missing CDI test method for the quarter. So if the quarter hasn't ended yet, or the data just hasn't been reported for the 3rd month of the quarter, that the 3rd month summary form is where CDI test method is collected, and that is required for risk adjustment. So all months in a quarter will be excluded on the SIR report and until CDI test method is reported for. So you'll see that table if you are missing CDI test method. Additionally, the CDI acute care 2015 baseline model has an outlier prevalence rate. So if your inpatient community onset prevalence rate is greater than the cutoff to be considered an outlier, an SIR will not be calculated in those specific cases. And all of those details are included in the SIR guide that's linked on this slide if you want to go into more detail or need a reference. Next slide. Okay, and then next we'll talk about the denominator, the SIR denominator, and how best to troubleshoot it. We're still using CDI as an example. And here on this slide is the risk adjustment factors table. So this is table 2 in the SIR report that everyone gets when you run a CDI SIR report. It lists all of the risk factors that are used in the number predicted calculation, which is your SIR denominator. So CDI uses CDI test type, the inpatient community onset prevalence rate, number of ICU beds, number of beds, facility type, an indicator for whether or not you report for ED or 24-hour observation locations, your facility's med type, and then all LabID SIRs use number of patient days when calculating number predicted. So it's important to review this table whenever you run your SIR report, just to confirm all of the values in this table look accurate. And if they're not, you can troubleshoot either by looking at summary data, the annual hospital survey, and I think that's it for all of these risk factors. Next slide. A common data quality question that we sometimes get surrounds CDI test type. So CDI test method is collected on the 3rd month of the quarter and then categorized into CDI test type for risk adjustment. So occasionally users may email us asking about CDI test type in this table and whether or not it matches what they selected for CDI test method. And so the CDI test type categorizations are listed in our troubleshooting guide. I also added a slide at the end of my portion of the presentation for the CDI test categorizations for the 2015 models. So you can use this for reference as well. And then another common question we get about CDI test type is that there is CDI test method question on the annual hospital survey. That is not the CDI test type that is used in your CDI SIR calculation. The CDI test method test type that's used in your CDI SIR calculation is the one that's reported for on the MDRO CDI summary form. Next slide. Oh, and then this is a table I was referencing earlier. This is what this missing CDI test type table looks like. So if you haven't reported CDI test type for a quarter yet, you'll see this table at the bottom of your SI report showing the months that you did report data for, and it'll show that CDI test type is blank and missing. Next slide. Okay, and then finally, we'll touch on how to know which events are counted in your SIR numerator. And so the full algorithms for how to know if an event is counted in your SIR numerator for CDI and MRSA is detailed in our troubleshooting guide. But here's kind of the summary of what's included in that criteria list. So for CDI, fact right in, for the numerator, the only events that are counted are in events that are reported in inpatient locations, excluding CMS certified IRF and IPF units. They should be categorized as healthcare facility onset, and they will be categorized as incident. And then for MRSA, bacteremia, fact right in, it would be events that are blood specimens from inpatient units, excluding CMS certified units, healthcare facility onset, and there's a deduplication algorithm for the previous 14 days that's used for MRSA. Next slide. Okay, so the quickest way to determine if a specific event you're looking at is or isn't counted in your SIR numerator is to run the line listing report, because in the line listing report, we automatically include these indicator variables that are highlighted at the end of this screenshot. These indicator variables are like a very quick, easy way to tell if a certain event was counted in your SIR numerator. The fact right in CDI facility incident HO count variable, that will equal 1 if an event is counted in your SIR numerator. So if you run the line list for a specific period, you should be able to add up the number of ones, and that should match your SIR numerator count for your SIR for that period. The second indicator variable on this list is for the inpatient prevalence rate, the inpatient community onset prevalence rate. So if you want to know which events are used in that prevalence rate, because that prevalence rate is used for risk adjustment, you can tell which events are counted in that prevalence rate numerator from the line listing report as well. And the indicator variable is the same for all acute care hospitals, critical access, long-term acute care, and rehab hospitals, freestanding rehab hospitals. If you have a CMS certified IRF unit, there are separate indicator variables that you would need to add to your line listing report through the modified screen, and those are listed in our troubleshooting guide if you ever need them. Next slide. Okay, that's the end of my part of the presentation. I did link the troubleshooting guide, some extra resources that might be helpful, and then there are a couple extra slides on like CDI test type and the examples that we had today for anything you need to reference later on. But now I will turn it over to my colleague Katie for her portion of the presentation.
Thank you, Sunny, and good afternoon, everybody. I'm going to take the next couple of minutes to go over a common category of data quality outreach that you might receive regarding your LabID data. My name is Katie Brusso. I am a contractor for NHSN on the Acute Care Analytics team. CDI test type is a required field on your facility's MDRO and CDI summary data forms for FACWIDIN and CMS IRF units on the third month of each quarter, those being March, June, September, and December. The question is formatted as a drop-down menu, which should be used to select the test method or algorithm that is standardly performed by the testing laboratory for your facility to identify CDI for the entire quarter. In this drop-down menu, you can find a plethora of common test methods and algorithms used to identify CDI. These include enzyme immunoassay, or EIA for toxin, cell cytotoxicity neutralization assay, nucleic acid amplification test, or NAT, NAT plus EIA if NAT positive, glutamate dehydrogenase, or GDH antigen plus EIA for toxin, GDH plus EIA for toxin, followed by NAT for discrepant results, toxigenic culture, and other. Your selection here is important because CDI test type is used in SIR calculations, and therefore selecting the incorrect CDI test type here will cause your facility's CDI SIRs to be inaccurate. I also want to take a moment to note that quarterly reporting of CDI test method is one of the reasons that CDI SIRs can only be calculated at the quarter level or higher. And in addition, CDI SIRs cannot be calculated in NHSN until CDI test type has been reported for the quarter. We strongly encourage facilities to select one of the pre-populated CDI test method options that is included in the drop-down menu. These options include many of the most common test methods that are used to identify CDI, and most facilities do not need to select other. However, facilities are able to select other if the CDI test method or algorithm standardly performed for the facility is not covered by the drop-down menu options. In these cases, the facility will be asked to specify the facility's CDI test type in a text box that appears next to or beneath the drop-down menu. One common data quality error that we see here is facilities entering PCR or polymerase chain reaction in the text box. Please note that facilities using PCR as their primary test method should always select NAT from the drop-down menu. PCR and NAT are the same test. Another data quality error that we frequently encounter is facilities entering sent out or outside lab in the free text field. In these cases, we encourage facilities to consult with the labs performing CDI testing for the facility in order to determine and therefore report the appropriate CDI test type for the facility. Remember, CDI test type is used in SIR calculation, and therefore it's important to select a drop-down menu in order to get the most accurate risk adjustment. NHSN reviews the text entered in the free text field in advance of CMS reporting deadlines. In cases where a facility enters other as the primary CDI test method, NHSN will contact the patient safety component primary contact directly via email at least once per quarter leading up to a CMS deadline. For outreach on this topic, you should keep an eye out for the subject line NHSN Data Quality Alert CDI Test Type Other. Whenever possible, we will include a suggested correction for the CDI test type that should be entered by the facility. We use the text entered into the free text field in order to make that recommendation. We ask that you respond back if you would like to confirm that the CDI testing algorithm used by your facility is not covered by our drop-down menu options. And if this is the case, we'll make a note so that you don't continue to receive this type of outreach. In addition, we ask that you respond back if you have any questions about this outreach or about choosing the correct CDI test type for your facility. We're happy to answer your questions and we're here to help. For facilities that do receive outreach regarding your CDI test type, we strongly encourage you to re-review these data and select a test type from the drop-down menu whenever possible. This ensures the most appropriate risk adjustment is given by the application. One quick way to review the CDI test type category that's used in risk adjustment for your facility's SIR is by running an SIR report. To do this, you'll need to navigate to the folder titled HAI Risk Adjusted Measure Reports, followed by 2015 Baseline, and finally CDI LabID. From here, you'll want to select the SIR report that aligns with your facility type. And for this example, we'll run the SIR report for an acute care hospital or ACH. Once you've obtained the output for the report, you'll want to scroll to the table titled Risk Adjustment Factors for FACWIDE and CDI SIR. Here, you can find the CDI test type category that is used in risk adjustment for your facility's SIR for each quarter that's included on the report. To do this, you'll want to locate the variable named CDI test type. So you can see in this example, this test facility entered EIA for 2023 Q1, followed by NAT for the following 3 quarters of 2023. If you need to change the CDI test type entered for your facility, you can do so by editing the MDRO and CDI denominator form for the 3rd month of the quarter. And let's walk through an example of how you would do that. Take a look at the top screenshot and you can see that the facility selected Other from the drop-down menu and then typed in DNA amplification, PCR in the text box. Remember, PCR and NAT testing are the same. So because this facility selected Other rather than NAT from the drop-down menu, the SIR calculated by the application will adjust for the incorrect CDI test type category and therefore will be inaccurate. Instead, we recommend selecting NAT from the drop-down menu, like you can see in the bottom screenshot. Doing this means that the SIR calculated in NHSN will account for the appropriate CDI test type and be risk adjusted accordingly. That's all for my demonstration, and I'm going to hand it off to my colleague, Emma.
Thank you. Good afternoon, everyone. Thank you for joining us today for this webinar on common data quality issues. My name is Emma Yu, and I'm a contractor epidemiologist for the NHSN Acute Care Analytics team. And I will be your presenter for this session on the topic of Pediatric Ventilator-Associated Event, or PedVAE, data quality issues. So in this session, we will be exploring 2 of the most common issues when it comes to PedVAE data reporting. We will also discuss several potential data quality issues regarding event dates. Throughout the session, I will provide practical demonstrations of these issues and discuss potential solutions. So let's dive right in. Let's start by reviewing some of the background information. First of all, what is a pediatric ventilator-associated event, or PedVAE? A PedVAE is identified by deterioration in respiratory status after a period of stability or improvement on the ventilator. It is assessed by monitoring two key parameters that reflect oxygenation status in neonatal and pediatric ventilated patients: fraction of inspired oxygen and mean airway pressure. So for NHSM, PedVAE data are collected for patients from neonatal and pediatric locations in acute care hospitals, long-term acute care hospitals, and inpatient rehabilitation facilities where the denominator can be collected. Such locations may include critical or intensive care units, specialty care areas, step-down units, and from those locations, data are collected from all patients in the neonatal and pediatric inpatient locations, regardless of patient's age. Patients on a ventilator who are receiving a conventional mode of mechanical ventilation or high-frequency oscillatory or jet ventilation are included. So let's dive into the most prevalent data quality issue that I've seen. That is, the number of device days was reported as some number less than 3, while at least one PedVAE was reported. Let's see an example. Let's say I went to the NHSN app, selected event from the sidebar menu, and then selected fund. I know the issue was about PedVAE, so I selected PedVAE as the event type in the drop-down menu and restricted the time period to July 2024. Finally, we can see there was one PedVAE reported during July 2024. Now, the next step I would do is go to summary data and find the summary data for that same month. We can see the ventilator days was reported as 1 day. The issue was that the number of device days should be at least 3 days, since the earliest date of event for PedVAE is day 3 of mechanical ventilation, where the day of intubation and initiation of mechanical ventilation is day 1. So how do we address this issue? The first solution was to go back to the summary data by re-entering the ventilator days to some numbers that is at least 3 days. Alternatively, you can remove this event from your plan. Another common data quality issue that is very similar to the previous one was that the number of patient days was reported as 0, while there was at least one PedVAE reported. So in this hypothetical example, there were 2 PedVAEs reported for a certain month. Both kids had birth weights that were between 751 to 1,000. However, the number of patient days were reported as 0, as you can see here on the right side of the screen. And the solutions are very similar to the first issue as well. You can either re-enter the number of patient days, or alternatively, you can remove the events from your plan. I want to quickly walk through some less common issues about some event dates. So here on the screen, you can see some key dates of a patient. From the left to the right are his or her date of birth, admission date to the hospital, ventilation date, event date, and the discharge date or the date of passing. So the first issue that can potentially arise is that the event date is less than 3 days after ventilation date, as we walked through in the first example. The second potential issue is that admission or ventilation or the event date is before date of birth, which is clearly impossible. And the third potential issue is that ventilation date is after event date. Then this event cannot be caused by this ventilation. Finally, an interesting note is that event date can be before admission date because the patient could be on ventilation before admission to the facility. And this is not a data quality issue, although it looks like one. So in summary, whenever at least one PedVAE is reported for a certain month, patient days should not be 0 or missing. Device days should be at least 3 days. And the dates should follow the correct chronological order. Thank you for your attention. If you have any questions, please do not hesitate to contact us. Now I will pass it over to my colleague.
Thank you so much, Emma. Hello, everyone. My name is Beth Baukamp, and I'm a public health analyst and contractor on the NHSN Acute Care Analytics team. I'm also part of the Patient Safety Annual Survey team. Today, I'll be talking about our annual survey data quality process and providing an outreach example. Next slide. Throughout this presentation, I will define the importance of NHSN and annual survey data quality, describe the impact of incorrect or missing annual survey data, list types of annual survey data quality checks, outline steps for the annual survey data quality process, summarize an annual survey data quality example, and identify steps for addressing annual survey data quality. Next slide. The Patient Safety Survey team regularly does data quality checks of the survey data submitted by facilities. These checks are key to identifying prevention needs and tracking progress. Facilities that have a potential data quality concern are contacted by the annual survey team. There are 2 types of outreach that the survey team conducts: routine outreach, which is done monthly or quarterly, and urgent outreach, which is done before CMS HAI reporting or other deadlines. It is important to note that the data quality checks done by the survey team are meant to complement checks that are done by a facility, not replace them. Next slide. If there is incorrect or missing data on the annual survey, it can have an impact for the facility and their reporting programs. Facilities that have an inaccurate SIR, it may not be calculated and therefore excluded from CDC analytic reports. Inaccurate SIRs may also be sent to CMS or excluded from CMS reporting if missing. Next slide. This slide lists examples of checks that the annual survey team conducts when doing a data quality check. A consistency check is confirming that the data are consistent across variables. A range verification is confirming that all the numeric values fall within the expected ranges. A completeness check confirms that all required data are complete and not missing. A year-to-year comparison evaluates the difference between values for the 2 survey years. Lastly, an outlier detection is checking for extreme values. Next slide. This image shows the steps for the data quality process. First, a facility will enter the annual survey data into the NHSN application. Next, the survey team conducts monthly data quality checks and identifies facilities with data quality concerns. Then the annual survey team will contact those facilities via email. Facilities will then review their data. When responding to the survey team, facilities can confirm that the data are correct, they can correct inaccurate data, or they could not respond, which could impact their CMS reporting. Lastly, CDC uses the annual survey data. Next slide. This is an example of a data quality check done on a facility. For the number of admissions, there is a year-to-year concern. The year-to-year concern shows that there is a greater than 100% difference between the admission values. Next slide. After identifying that this facility needs outreach, the NHSN team sends an outreach email. This email shows the different sections, or this example shows the different sections that are included in an outreach email. The survey team first identifies the patient safety component and the NHSN org ID, and then provides background information on NHSN data quality. Next, we explain the potential concern and provide the facility with action items. Lastly, we provide contact information if the facility needs additional support from the survey team. Next slide. Included in the outreach email is an attachment like what is shown here. The attachment includes instructions for reading the data table and a variable key showing the descriptive variable name for the variables in the table. The last part of the attachment shows the data reported on the facility survey that needs review by the facility. Any variables that are not flagged as a data quality concern are labeled as no action needed. Next slide. These are the action steps a facility should take if they receive a data quality outreach email. First, read the email to understand the potential data quality issue. Know any deadlines provided in the email and understand the action items. Next, review the facility data report attached to the email. Lastly, determine whether the data are correct or incorrect. If the data are correct, reply to the email explaining that the data are correct and what led to the unexpected value. If the data are incorrect, collect the correct data and edit the annual survey. Respond to the email if requested. Next slide. These resources may be helpful if your facility receives a data quality outreach email. The annual survey webpage and data quality webpage contain many resources, and linked here are guides on how to find and edit the annual survey, run and export facility survey reports, and the facility FAQ. Next slide. So I think that is it for our presentations. We have a few minutes left so we can do some Q&A. So if anyone has questions that haven't been answered yet, feel free to put them in the Q&A box. And presenters and panelists, if there's any question that you think would be better answered live, you can unmute and answer that question now.